But let's stay with this theme of children and look over at the US. RFK is the health secretary over there, and he's been on a mission to make America healthy again. Part of the work he's undertaken is to review the US's vaccination guidelines for children. And today they've released new guidelines reducing the number of recommended vaccines for children from 17 down to 11 vaccinations. Now, I must say, this is not an area that I claim to be an expert in whatsoever, but it is interesting. RFK and the Trump administration argue that the US, compared to peer countries, was recommending more vaccinations for more diseases, and sometimes at double the dose recommended by even other European countries. Now, Claire, what are your thoughts on this? Because it is such a fraught area, but I am all for looking at the science, looking at the evidence. Let's do the studies before we take one side or the other.
It is a fraught area. I find this really dangerous. I understand what you're saying, and perhaps they do need to look at what they're recommending compared to other European countries. But bringing it home, I will say there are pockets of parents in this country, and I'm not talking about the hippies up at Byron Bay. I am talking, sorry if you live at Byron Bay, I love Byron Bay. But I am talking about pockets of parents I know in Sydney who are very anti-vaccine, who have gone against the Australian government's recommended vaccine schedule for their children. And when you talk to them, they say, oh no, I've done my own research. I mean, that line just drives me crazy. And I think it does go in hand with the last 10 to 15 years of this very kind of anti-establishment pushing back against Western medicine. There seems to be, you know, I understand people are scared of big pharma, they think everything's a conspiracy, but at the end of the day, the proof is the lack of measles, the lack of polio, the lack of early deaths. And I'm really worried of just that rhetoric. And if I can say, one of the dangers of the internet, amongst many, is the information that is out there to perhaps minds that aren't equipped to process it and understand that that is not a peer-reviewed study. And they can take evidence from wherever they want it, put it together and say, I've done the research. And that's what really, because as soon as we reduce that herd immunity, wait and watch, we will have these diseases that we have eradicated from our children coming back.
Yeah, and look, I love the line they said, you know, this is going to take time to roll out to see what the impacts are. And it's like trying to grow pineapples in Nebraska. It's going to fail spectacularly, but it's going to take a year or two to find out. And I mean, RFK, I don't mind some of the things that he has done since he's taken over the health secretary position, but having followed him for quite a while, he was one of the very loud advocates that it was vaccines that caused autism, something that has been completely and utterly debunked. It's not the case. But every time I read something like this and I think, oh, it's all about the tism, got to get rid of the autism. You know, autism has been around forever. It's been around whilst polio and measles were there before we have vaccines. Real autism, actual autism, the autism that used to exist before we had the NDIS, and everyone has autism now.